All right, we're about to dive into one of the most incredible and honestly most mysterious mechanisms of the human mind, dissociative disorders. This isn't just some dry clinical topic. No, this is a real journey into how our brains cope when things get unbearable. We're going to look at what happens when the mind literally disconnects just to survive.
So picture this. A person walks into a clinic and they have no idea who they are. Their name, their family, their entire past, it's all just gone. Or how about this? Someone suddenly can't move their arm, but every single neurological test, every scan, comes back completely normal. There's no physical damage at all. You know, these aren't scenes from a movie. These are the real baffling puzzles that doctors have to solve.
And that brings us right to the heart of the matter. This is the central question. When the body is showing these very real symptoms, but there's no physical cause you can point to, are we looking at a problem with the brain's wiring, or is something much deeper going on psychologically? That's the core mystery we're going to unpack right now. To even begin to answer that, we have to understand the fundamental why behind all of this. We're making a shift here from the mystery of what's happening to the core reason why it's happening. And it really all boils down to one incredibly powerful concept: protection. Okay, so here's the official definition. A dissociative disorder is a breakdown in the way we normally stitch together our consciousness, our memories, our sense of self. But the most important part of that whole sentence, the part you really got to focus on, is at the very end. Often triggered by psychological trauma. This isn't some random glitch in the system. It's a direct response to something absolutely overwhelming.
And this is the key insight, really. This is the aha moment. Dissociation isn't a flaw. You could almost say it's a feature. It's this powerful, primitive survival tool. When a person is faced with trauma that is just too much to process, the brain essentially hits an emergency eject button. It disconnects certain functions to shield the conscious mind from the full, devastating impact. It's a profound, incredible act of self-preservation.
So now that we kind of get the why, let's dig into the what. This protective disconnection, it doesn't look the same for everybody. It can show up in several really distinct ways, and we're going to break down the 4 main forms right now.
First up, you've got dissociative amnesia. We're not talking about just forgetting where you put your keys. This is about significant, large gaps in your memory about important personal events, often centered around a trauma. Then, things can get even more extreme with dissociative fugue. A person might suddenly travel far from home, completely forget their past, and sometimes even take on a whole new identity. And then, of course, there's dissociative identity disorder, probably the one you've heard the most about, where 2 or more distinct identities, sometimes called alters, exist within one person. And finally, there's depersonalization/derealization, which is this really surreal feeling of being detached, either feeling like you're watching your own life from the outside, like in a movie, or feeling like the world around you isn't quite real.
So, understanding these disorders, that's step 1. But the really important question is, how do we help someone put those pieces back together? So let's shift our focus now to the path forward, the journey of diagnosis and, most importantly, of healing.
Now, what's really interesting here is a distinction that causes a lot of confusion, even for clinicians. With dissociative disorders, the core issue is a loss of integration, right? The different parts of the self, memory, identity, consciousness, they aren't communicating properly. They're fragmented. In psychotic disorders, on the other hand, the core issue is a loss of reality testing, a struggle to tell what's real from what isn't. Nailing this difference is absolutely critical to getting the right diagnosis and the right help.
The path to healing, well, it's a structured one. It all starts with the foundation, which is trauma-focused psychotherapy. That's step 1, and it's the big one. That's where the deep work of reintegrating those disconnected parts happens. Then, for step 2, you have key techniques like cognitive behavioral therapy or grounding exercises, which help a person manage their symptoms day to day and stay connected to the present. And, this is really important, step 3 involves treating related conditions. See, medication isn't for the dissociation itself, but it can be a huge help for the depression or anxiety that so often come along with it. The whole goal is to heal the root trauma.
So let's just end on this thought. We've seen that dissociation is this incredible testament to the mind's ability to protect itself when faced with the unimaginable. It's a survival mechanism. But if our minds hold that incredible power to disconnect, just think what that says about their power to reconnect. This isn't just a story about a disorder, it's a story about the profound resilience and the amazing capacity for healing that lies within every single one of us.